Hello everyone. In this presentation, we are going to see about the topic intervals and segments in the ECG. So, first of all, ECG is the electrical activity of the heart. So, it consists of waves, intervals, and segments. So, in this, we are going to see about the intervals and segments in the ECG. So, first of all, intervals. Intervals include waves and the time between them, which is it contains waves as well as the connecting line. And next is the segments, which is a flat line without waves, which means it contains only the flat line or baseline or an isoelectric line. So first we are going to see about the intervals. The first one is the PR interval. The time from the onset of the P wave to the onset of the QRS complex is the PR interval. Normally, the duration is 0.12 to 0.20 seconds. It's also said to be 120 to 200 milliseconds. So, physiological significance. It represents the atrial depolarization and conduction through AV node, bundle of His, and Purkinje system. The next is the QRS interval. We can also say this as QRS duration. The duration of the QRS complex is because of the ventricle depolarization. We know it is the contraction of the ventricle is happening during the QRS phase. So its normal duration is about 0.08 to 0.10 seconds. Physiological significance, we know that it represents ventricular depolarization. Next is the QT interval, the time from the beginning of the QRS complex to the end of the T wave. Its normal duration is 0.36 to 0.44 seconds. It varies with heart rate. If the heart rate is getting higher or lower, it changes accordingly. Physiological significance, it represents total ventricular activity, which means it includes the depolarization and repolarization, which is the contraction as well as the relaxation. The next is the RR interval. It is the time between two consecutive R waves, which means one R wave to the other R wave. Physiological significance, as it is used to calculate heart rate. Next, we are going to see about the segments. The first segment is the PR segment. It is from the end of the P wave to the beginning of the QRS complex. Significance, it represents delay at AV node. Next is the ST segment. It is from the end of the QRS complex, which means exactly at the J point and to the starting of the T wave. So ST segment is from J point to the beginning of the T wave, and it represents early ventricular repolarization in an isoelectric state. The next is the TP segment, end of the T wave to the starting of the P wave. Significance, baseline used for measuring ST segment elevation and depression. So these are all the normal segments and intervals that we notice in the ECG. Thank you.